Just 3 years ago, the city of Chicago closed half of its 12 public mental health clinics. The ultimate victims are minority and low-income communities. In 2011, the city of Chicago's public mental health clinics provided care for more than 2,400 patients. After the 2012 consolidation, that number dropped to 1,200 in just 1 year. And the latest report from the Department of Public Health suggests less than 1,000 patients remain in the system. The closing of the 6 clinics has caused tremendous pressure on the city's emergency rooms, hospitals, and correctional facilities. Cook County Jail currently houses more than 2,000 mentally ill inmates. Experts and advocates agree that incarceration is not a solution to this problem.
Mental illness has been effectively criminalized in this country. Clinics are going away, hospitals are going away. Illinois has been at the top of the list of cuts to mental health services for many years now. This is the effect. Cook County Jail is not only the largest single-site jail in the country, it is the largest mental health institution in the country. This is not a place for anyone with even a mild mental illness, certainly not a serious mental illness.
We met 28-year-old Raymond Olvera in Cook County Jail. He says he's been in and out of jail since he was 10. At 12, he was diagnosed with bipolar schizophrenia.
So how would you say the mental health care inside Cook County Jail is?
Horrible.
Why?
Because you're locked in the cage, you're locked in the walls. There's nowhere to go.
But in regard to like access to doctors and medication?
Still horrible. Nothing makes it right. Whoever thought of the penal system as a good thing, it's not.
It's a waste of everybody's time and resources, and of course it's very destructive for these people themselves. What they need is community-based treatment, and that's not what they're getting. So that's the fundamental problem. Frankly, we're asking Tom Dart, the sheriff, and the jail in general to do something that's impossible. A jail is not the place to provide mental health treatment. It just isn't. Because it's a revolving population, it's the wrong sort of setting for mentally ill people. It's full of tension, it's full of stress all the time, and it's not a conducive environment for health, even for those who start off very healthy. And if you go in mentally ill, then it's a toxic environment for mental health. We've definitely dealt with people who started off with fairly minor offenses going into Cook County Jail, decompensated inside the jail, lashed out at somebody, ended up prosecuted for felony, ended up in prison, even though the underlying thing they were picked up for was something minor like trespassing or shoplifting or something along those lines. They end up in the state prison with a felony conviction for assaulting a correctional officer. And it's really a question of mental illness, and that makes no sense to anybody.
You're right. You're very smart.
Families of mentally ill inmates are affected the most. Mandy Romero has tried for 4.5 years to get her incarcerated husband the medication and proper care that he needs.
It's not just a roller coaster for him or I, it's a roller coaster for the entire family. I won't take my kids to see him. It was a battle for many years to get him on medication at county. It was the ups and the downs, and then finally we get him on medication. We think we're doing good. He gets found guilty, he gets sentenced. He goes to Statesville, and it's the same battle. Now I have no contacts. I made my contacts. I learned who to talk to, who not to talk to at county, who can get stuff done. So then we go from finally figuring out all of that on my own, for 4 years, then going to IDOC and having to start over, not knowing who to contact. You call the Statesville. You're lucky if they even answer the phone and you get a live person. So then that's when my brother-in-law went to visit him and found that one sergeant who said, "These are the 2 doctors that you need to talk to. Here's the number." He goes, "Your brother needs to be in a mental hospital, not prison."
50 years from now, people are going to look back at us and say, you were the people that locked up folks who were ill, and that people who had an illness, you threw them in prisons and jails. And I don't think anybody would ever want to be seen as that's your generation. That's where you came from. That's what you were about. And that's why I think we should care beyond the individuals who have had mental illness impact themselves and their families. I think as a society, obviously I believe it's morally wrong to be doing this, but I think that people ought to look at how are you going to be viewed as a society decades from now. And I don't know how you get away from the the numbers are stunning. Mind-boggling that we are affirmatively locking people up because they're ill. We have extended ourselves so far on this because it's the right thing to do. Every one of these other players that you name could do the same thing if they chose to do it. They choose not to. Could they give you all sorts of reasons why? Yeah. Are they making it up? Absolutely, they're making it up. When you talk to a lot of people in the judiciary, you bring up the issue of mental illness. Frequently what they'll say is they say, oh, yeah, God, yeah, we're right on top of that. We have a mental health court. And then most of the public would have no reason to sit there and say anything other than, oh, that's great, fantastic, you're on top of it. Do they ever sit there and say to you that, hey, and by the way, our mental health court, the number of people on their caseload for a year is about 200 people, and that on any given day there's about 2,000 to 3,000 of them in the jail? Now, would there be any thoughtful person other than maybe a 5 or a 6-year-old who would sit there and say, yeah, we're tackling that problem head on? No. They would be coming out there and saying, listen, we have a big problem. We need to get more aggressive in working on this on multiple fronts, diverting people from the front end, and then for the people that are in here, coming up with plans for them when they leave. But people sit there and, as I say, they make up their stories, and no one's ever to blame. Everybody means well, and everyone's trying. And that's just not true.
The Cook County Jail has vastly improved its mental health treatment, no question about it. As you pointed out, we have closed the clinics on the outside, so the city has made its treatment worse. On the other hand, the Affordable Care Act has come in, so some people are able to get insurance and can actually get mental health treatment who couldn't before. So it's a lot of different moving pieces out here. The real failing is that all these pieces aren't coordinated.
Personally, I'm a consumer of mental health services. I have a psychiatric diagnosis. I've struggled with mental health concerns for the majority of my life, and I realize not everybody has the ability to stand up and advocate. People are scared. So if somebody doesn't speak up and say something, nobody will, because the city has basically told us go away.
No, I know.
You want us to run or walk out of here? Hold on.
All I'm doing is asking you to please leave so we can maintain this proper area. But if you'd like to schedule something later and bring as many people as you can, we're happy to try to accommodate you, okay? Thank you.
I know what happens when I don't get my medication. I become suicidal, I can act out. It's not safe.
What should have happened is we have the Affordable Care Act, you expand the clinics because then people can get insurance, you set up an outreach program to make sure that everybody who's homeless knows they can get insurance, knows they can get treatment, have that treatment available in their neighborhood, hook them up when they get out of Cook County Jail so they're immediately connected with one of these clinics on the outside. It's a system that all the pieces are in place, so it ought to work, but none of those pieces are being coordinated, so people are just sort of bouncing around. I sort of envision a pinball in a pinball machine. You bounce from here to here and you might hit a bumper that gives you treatment and then you're ejected out into the system again and you got to bounce around until you happen to connect again. And none of it's intentional. Somebody needs to be in charge and say, we have actual human beings here who need a consistent course of treatment. And we're not doing that. We have all the pieces out there, but none of it's being put together. And we have the tools now, we're just not using them.